Hello everyone, this is MBBS Gallery. Today our topic is thoracic duct. It is most important in examinations. This is a duct. This is a lymphatic duct actually, which is also known as Hun's canals. This is the largest lymphatic duct of the lymphatic system of the whole body, and it is about 45 centimeter, and it resembles a beaded appearance due to the presence of many valves in the lumen, so that it gives a beaded appearance. So this is the thoracic duct, which runs from the posterior to the neck, posterior abdomen to the neck, and we see it in little more clear. Actually, to have a rough idea, this is a structure called cisterna chyli. This structure, from its upper part, actually the thoracic duct, it is just a continuation of upper part of the cisterna chyli near the lower part of the T12th vertebra, thoracic vertebra, and then it enters the thorax through the opening called aortic opening of the diaphragms, and then we are going to see little more clear. So thoracic duct. So thoracic duct, also known as Hohn's canal, is the largest lymphatic vessel of the lymphatic system of the body. We know that, and it is approximately 45 centimeter in length. It has a beaded appearance because of the presence of many valves in its lumen. So these are all the introduction, and let's move on to the topic course. The thoracic duct begins as a continuation of the upper end of the cisterna chyli near the lower part of 12th thoracic vertebra and enters the thorax through the aortic opening of diaphragms. We already know this, and if it then ascends through the posterior mediastinum from the level of T12 to T5, where it causes from right side to the left side. This is we already know. Then it courses through the superior mediastinum along the left edge of esophagus and reach the neck. Relations. This is little more complex to remember, but if you read in a clear-cut way, then it may help you to remember all those relations, whatever related to the structures. So relations at aortic opening of diaphragms. We are going to see relations on the fourth topic at the aortic opening of the diaphragms, and in the posterior mediastinum, and in the superior mediastinum, and in the neck. So firstly, we have to see about aortic opening of the diaphragms. It related to anterior, posterior, and to the right and the left. Anterior is related to the diaphragm, and posterior is related to the vertebral column. To the right, it is related to the azygos vein, and to the left, it is related to the aorta. Here we already saw azygos vein. It is in right side, and aorta in the left side, likewise in the opening of the diaphragm. And in the posterior mediastinum, anteriorly it is related to diaphragm, esophagus, right pleural recesses, and posteriorly it is related to vertebral column, right posterior intercostal arteries, terminal part of the hemiazygos vein, and to the right by azygos vein, and to the left by descending thoracic aorta. Third, in the superior mediastinum, anteriorly, it is related to arch of aorta or the origin of subclavian arteries, and posteriorly, it is related to vertebral column. To the right is related to esophagus, to the left it is related to pleura. So in the neck, the thoracic duct forms an arch rising about 3 to 4 centimeter above the clavicle. So let us see about its tributaries. The thoracic duct drains lymph from right and left descending thoracic lymph trunks originating from lower 6 intercostal spaces. Actually, the tributaries are here. We can see the tributaries. This is the descending thoracic lymph trunks. This is the important one of the tributary, both right and left side. So, and another important tributary additionally are left jugular lymph trunk, left subclavian lymph trunk, left bronchomediastinal lymph trunk. These are all the additional tributaries. Let us remember by the mnemonic ML3. M for mediastinal lymph trunk, L3L left jugular trunk, left bronchomediastinal trunk, left subclavian trunk. And about clinical significance, there are 3: chylothorax, Virchow's node, thoracic duct fistula. What is chylothorax? Chylothorax. Rupture of a thoracic duct causes chyle to leak into the pleural cavity. This is, we call it as chylothorax. And then Virchow's node and thoracic duct fistula. This is all about thoracic duct in a simplified way. It's actually completely from BDC. So thank you.